Hello. Today I'm going to share a piece of the story of why and how we decided to expand and deepen our presence across Latin America and the Caribbean. So imagine a region where more than 8 in 10 people live in cities, with a GDP twice that of India, with 1/3 of its people. A region that houses 50% of the world's biodiversity. And at the same time, a region with multiple cities with populations greater than that of New York City. And that is our beautiful and beloved América Latina y el Caribe. I am Emilia Carrera, and I'm a director part of the Rockefeller Foundation's Health Initiative. And I've had the privilege of leading the thinking of how and why we should open an office back in the region. But the story is more than opening an office in the region where we already had investments. It's a story about trust, relationships, partnerships, and reflection. The Rockefeller Foundation has been present in Latin America and the Caribbean since the 1930s. And I would say we even had physical presence with offices across the region, from Mexico to Argentina. But in the early 2000s, we stepped back. So why now? Why in the last 5 years it was so important to look back at the region and pay more attention? Let me share some stark realities. Latin America and the Caribbean is one of the most unequal regions in the world. 93% of all events recorded by the UNDRR were extreme weather related. Last year, in 2024, the number of dengue cases in the region reached more than 12 million. That's a 358% increase compared to the average of the last 5 years. This is an escalating public health problem for the region. Between 2013 and 2022, infants were exposed to 248% more heatwave days. People over 65-year-olds were also exposed to more than 200% heatwave days. And both of these examples, dengue and heat waves, present health challenges that severely impact humans and people, but even more so pregnant women. And the negative health outcomes can range from headaches, discomfort, inability to live our daily lives and work in our daily lives, to premature births, low birth weight, stillbirths, transmissions from mother to fetus. And despite all these challenges, I've seen communities, cities, countries innovating and being resilient. I've seen frontline decision makers being creative and creating advanced tools to be able to better prepare, plan, and respond to these challenges. I've seen communities adapting in ways that we could teach the world. And so, as I reflect on our journey, I would say that a key word that comes to mind is trust. Trust from my leaders to let me take an idea into something that the foundation could build on and act on. Trust from my colleagues who worked in a different way. We broke silos to make this happen. And finally, but definitely not least, trust from our partners, grantees, and collaborators on the ground who provided insightful advice, honest feedback, and perspectives about what the opportunities were. And so as we go through this journey and as we open the new office and build the new team, I'm thinking about that topic about trust and how do we introduce the new team to these relationships and partnerships without eroding that trust? And how do we do so efficiently and effectively? And I know I'm going to be leaning into my WomenLift health community as we go through this journey, as I am excited that we're closer to the communities that we want to serve so that we can listen more deeply, learn quicker, and amplify our impact.